Hi friends, Dr. Lisa here, cancer physical therapist and bone fit trained professional. And I received a question recently from a person who's been through radiation treatment, and they were commenting about the pain in the ribs and asking what could they do about that pain that wraps around the rib cage on the treatment side that had radiation. And I want you to know that this is a very common issue to have after radiation treatment, that this pain is very treatable and resolvable, and it's not unusual to have that at all. Now, in the clinic, I often do a lot of manual therapy or massage type techniques to help relieve that tightness in between the ribs and those intercostal muscles. But I also give exercises to clients to help improve the mobility of the rib cage, and that's what I'm going to share with you today. So these are important exercises to help improve the movement, mobility, expansion of the rib cage. This helps improve your breathing, which is important on so many aspects, and it might just help reduce your pain as well. So the first one I can do, and I'm on the floor, but you can be sitting in your chair, just being comfortable. I just want you to be up nice and tall. You can also do this standing. This can be really effective because I want you to feel it. And then I want you to put your hands on your ribs. Again, being up in a nice tall position. And I want you to take a breath in, and I want you to feel your hands kind of move outward and slightly upward as the ribs expand. And if you don't feel that too much, think about pushing your ribs into your hands. And then when you exhale, we're going to gently apply a little bit of pressure downward so that the ribs are moving down and in, and then lifting up and out. So it's moving in this way. So hands on the rib cage, big breath in. Feeling the ribs move out, exhale. Hands coming down and in together. In. Good. Out. Give a little extra stretch on the out. Pulling the ribs down and together. Taking your time so you don't get dizzy. You can pause and take a break. So hopefully you can see this movement happening in my rib cage. And you want to do that also. And you could do 5 to 10 repetitions, maybe 3 or 4 times a day, encouraging movement in the rib cage. Because often when we have pain there, then we start to breathe more shallowly and things become tighter and more stiff. So we want to work that full inhale and full exhale and really feel the expansion of the rib cage when you do it. Right, next up, I have 3 stretches that I like to also help improve that mobility in the rib cage and reduce some of that tightness and pain you may be experiencing. One of them is what's called child's pose or prayer stretch in yoga. So getting on your hands and knees, walk those hands forward, lean back, crawl those fingertips forward, let the chest sink down towards the mat. And in that position, in that fully extended position, I want you to take a deep breath. And I want you to breathe in a way that you're moving the ribs in a 3-dimensional manner, side to side and front to back, so that you feel that openness of this barrel that is your chest when you take that deep breath in. And then as you exhale, you want to feel everything come together, like a big expanding circle through the chest, and then the circle gets smaller as you exhale. So we'll all come down into this child's pose. Take a big deep breath in. Exhale. And you could repeat that 3 times. Taking your time. Good job. Adjusting as you need for any discomfort. You can pull the elbows back if it feels better. Find that position of comfort and then breathe into that stretch position. Now, position number 2 is to walk both hands off the mat. And now we're getting opening of the ribs on my right side as my hands are on the left side of the mat. And now I want to direct the breath to the right side ribs. And if that is the treatment side, then this is going to be the sweet spot for you. So we go into this slightly curved position of the spine. I'm reaching forward with my right hand. I'm reaching back with my right hip, folding over, and then a big breath into those right ribs, trying to create space in between those right ribs. Big breath in. Hold it all the way. Do 3 breaths on that side. Come back to the center. Walk your hands over to the other side of the mat. And if that left side was your treatment side, then this is the one that you're really going to feel the biggest difference for. But definitely do both sides. So give that breathing technique a try, and this 3-position child's pose with really intentional breathing and movement into the rib cage, and see if you can't relieve some of that pain you're having. Right. Peace and health, everybody.